Very good afternoon to all of you. Thanks for joining us here on The Big Story. I'm Afrida Rahman Ali. Our top focus on the COVID surge in West Bengal today. All right, as we all know that it's an 8-phase election that is being held in the state of West Bengal. There is still one more phase of polling left in the state. Now, there's been a lot of concern around what kind of impact the mass rallies would have had on the COVID cases. And now we have the facts and figures in front of us, and it's rather disturbing. Let's take our viewers through the numbers that are showing up now. Daily cases in the state has risen 30 times in the last 1 month. Yes, you heard that right. 30 times as much in a period of 1 month. And it's not lost on anyone right now that this is the month where all these political rallies and election campaigning happened for the state polls. On the 25th of March, Bengal recorded 516 cases only, whereas in the last 24 hours, the daily cases stood at 15,992. And you can just do your calculation and see how many times more the cases are being reported now. In Kolkata, nearly 4,000 cases have been recorded in the last 24 hours. The positivity rate has doubled from 16% 10 days ago to over 32% on the 26th of April. So there again, a big rise in the positivity rate. Bengal is yet to complete one more phase of election, which is on the 29th of April. So this is our issue, our topic of discussion right now. And as always, we are going to have representatives of the two major political parties to help us understand what are we going to do now? Who did this? This is clearly a man-made disaster. Touseef Khan, TMC supporter, joining us this afternoon. Anila Singh, BJP spokesperson, joining us as well. We will have, and I think we already have Dr. Rupali Basu, MD and CEO of Woodlands Hospital, joining us as well. Thank you so much for joining us on this edition of The Big Story. Unfortunately, it's a rather grim picture. I'm sure all three of you would at least agree on that when we say 32% positivity rate in Kolkata, it technically means that of all people tested, 1/3 are turning positive. At this stage, Touseef Khan, would you concede that this is a man-made disaster? You've literally shown the red carpet to the bull. This was like an open invitation for the virus to come and unleash itself. And I'm sorry, it doesn't help to say that the EC should have taken a decision. You are seeking votes for a leadership. What is the leadership supposed to do? You were supposed to lead by example.
I completely agree with you. The reason for second wave of corona is Modi government declared victory over the virus prematurely. And why I say that, Union Health Minister, Narendra Modi's health minister.
No, Mr. I'm sorry. Let's not start with that. Let's start with what your party has done. Did your party campaign for the elections and boast about big numbers in your rallies, or you decided to relinquish all campaigning? No, why do you have to? Why do you claim to be the protector and the preserver of people's rights? And why do you claim to be the biggest messiah for people's welfare when you just did not care? There was scant regard for any COVID protocol. You invited the virus to attack the people of Bengal. And now you're saying it's only Modi that should take all responsibility? The states don't have responsibility?
Yes, Modi will have to take the responsibility. Mamata Banerjee went to Election Commission and asked Election Commission to clap the remaining 3 phases of election in 1 day. It was Narendra Modi, BJP political leaders who went to Election Commission and opposed such demand. It was BJP who opposed clubbing of the remaining phases of election. Why the...
No, I am asking you, why did you campaign? Why did you allow people to gather in large numbers? Any kindergarten kid knows that this is a human-to-human transmitted virus. Mass gathering is a recipe for disaster. Why did you allow it? Forget what the EC was supposed to do or BJP was supposed to do. Are they the role model that you're following? Is BJP your role model?
I think even a kindergarten student will laugh at the bogus argument that you are making. Who decides how elections are to be conducted? It is election
where is the
commission
bogus argument? Please specify.
Trinamool does not decide that. Trinamool never decided that election should be held at this time and in 8 phases. Rather, Trinamool strongly opposed this. from the very beginning that we're living in a corona time. It was BJP's health minister who said that we are in the end game of COVID pandemic. On 15th January, health minister said that beginning of end of pandemic. On 26th January, world is on the verge of defeating coronavirus, said by Harshvardhan in World Health Organization
No, I will
meeting.
ask those
On
questions to
7th
the
March,
BJP
we are in the
spokesperson.
end game.
I was asking you a specific
No,
question
BJP
on
had
why
no
did
right.
you not do
I
your
am giving you
responsibility,
specific-
knowing that this is a
specific,
virus
yes.
that transmits human to human, not allow people of Bengal to get infected in such numbers? Did you do your
BJP
responsibility to protect the people of
had
West Bengal
no.
when you could have? That's the only thing I'm raising, sir. Okay,
BJP
let us
had
bring in
no-
Anila Singh and
no
ask her
right
all
to
the issues that
mislead
you are
people of
raising, which
Bengal,
I
the
do
country
agree
and
is a
election
valid
commission.
question. Anila Singh ji, I mean, this is now evident to all of us that there was a premature celebrating a victory over COVID-19. This was some sort of a self-congratulatory mode that the Prime Minister and your leadership went into. And that, let me also agree with Mr. Khan here, actually led to the lowering of the guard. That is the primary thing. But when it comes to Bengal, I mean, right in the middle of the second wave as well, your leaders were very much campaigning in West Bengal, Anila Singh ji.
Afrida, first of all, when we talk about coronavirus, then I have to tell Mr. Khan that Mr. Khan, this virus doesn't see that it is going to infect people from one particular political party or from one particular area or religion. So, Prime Minister of this country understands it very well.
So why
And
did you oppose?
I did not talk over you, gentlemen, and you should have that much of decency. Even I know how to shout, and
No,
I know.
please let
but
Anila
I do
Singh
not
ji
want to-
finish.
I do not want to holler, and this is because this is a very serious situation which our country
Why
is
did
going
BJP
through.
oppose?
There is Let me tell you, do you have any proof that BJP opposed?
Yes,
And let me tell you
they
one
said
thing,
it
you
on
have
record.
some sense that
They
how
said
the
it on
elections are
record.
being
No, it is
BJP
true,
said it
Anila
on
Singh ji,
record.
that
They went to
BJP
election
did
commission.
not agree to club the remaining phases of polling. To that extent, you have to admit that the BJP did not agree to club the remaining phases of polling into one phase. Why didn't you agree to that? At least that could have restricted
First
some
of all,
damage.
Afrida, let me tell you, when whole of the world was facing the wrath of COVID last year, India too, but India managed the scene so very well that it is being discussed in other countries as well. Yes, we were fighting the corona. Everything was there. Vaccination came in time. Everything was like, I mean, definitely whole machinery, whether we talk about the central machinery or the state machinery, in a good coordination, everybody was working against this coronavirus. But nobody thought that this new mutant is going to attack us in this way. Definitely nobody knew about it. But if I say that TMC
No,
says...
Anila Singh ji, the whole world knows that the nature of the pandemic, there is an impending second wave. That was widely known. I'm surprised you're saying that nobody knew that there was a second wave coming. I agree about the point about the mutant virus, but that apart, people knew there was a second wave. I'm going to bring in the doctor on the show.
This is going to attack
Okay,
on
please
us in
finish
this way.
quickly.
Nobody knew. No, nobody knew. New mutant. This is going to attack on us in this way. Nobody knew. And secondly, I just want to say one thing here, that if TMC says that Bharatiya Janata Party is to be blamed to have 8 phases elections in West Bengal, then they should take this complaint to the Election Commission. And secondly, people of West Bengal, they are going to answer. Why TMC is so perturbed? If people of West Bengal thinks that Bharatiya Janata Party is wrong, they are going to give answer through their voting.
So now you are talking about electoral gains and electoral outcomes. We are not bothered about that, Anila Singh ji. You have to hear the doctor on the panel who will actually now tell us what the ground situation is. Dr. Rupali Basu, welcome. I want you to tell us what exactly is the situation on the ground in West Bengal. We are hearing that there is already a crunch of beds, already a crisis of oxygen supply. Medicines are in short supply. Can you give us the status as a doctor working on ground? What are the daily challenges you're facing at the moment?
So I was listening to the panelists, and I was just thinking that how politics can also influence the discussions on science. Health is purely a scientific matter, we have to go by the scientific, thought processes, scientific data, and have to move ahead with that. So when we had the last year, when we had the wave, the first wave, we had at about 100,000 people were affected that year, and then it went down to almost zero in our
Yes.
hospitals. All our hospitals, COVID wards became zero. And that was in the month of somewhere in December, January, we were almost closing our COVID wards in both government and private sectors. And then suddenly, and we were kind of thinking that that all our guards were loosened, and we were moving in large congregations, political rallies, social gatherings. We were doing all that, and of course there was this what Mr. Singh was talking about, the new strain. But new strains were coming in all the countries, so we should have been prepared for the new strain, and we should have been prepared for how to protect this year. And
what is the extent of the crisis now, Dr. Basu? Are you able to deal with the numbers, the 30% positivity rate in Kolkata, for instance? What is it translating in real terms?
I would say that the second wave has crossed 3 times. The country is 3 lakh per day, 300,000 patients, infected patients today. So which is and it has happened over a period of 20 days. So it's just started in April beginning. So it's a very sharp rise for the second wave. We hope that it starts coming down, because Bombay is showing signs of coming down. So maybe Delhi and Calcutta will be. But in Calcutta right now, we have, we have 12,000 beds. We have prepared everything possible. Last year, it is true that we did manage pretty well. And this year also, we were managing it very well. But at the same time, the numbers are very high. So at this moment, we are stretched on our beds. We are stretched on medicines, oxygen, everything. The simple hospital that I am managing, the topmost hospital in Calcutta, where I have never faced I have an oxygen plant, because I'm a top hospital. So, but we never had so many distribution points to so many patients in the hospital needing oxygen. This is completely unprecedented. We never had so many patients, 70 patients on remdesivir alone, where you have to get the prescription one-to-one. You are getting one patient getting admitted, you are getting 6 vials for that patient.
Yes.
And we know that how good it is having an effect on the infection. It's giving 2 dosage of remdesivir, you have a wonderful recovery. So it is very important, and medications. So we are kind of stretched, but we are managing. We have now got a and we are working with the government actually. And to us, it is very important that whoever is the political party managing the government, for us at the scientific level, at the doctors, and at the ground level, we have to work with the authority, because hospitals are all licensed. But
there is a crunch, is what you're saying. There is a crunch. There is a crisis situation. And this could have been averted if enough precautions were taken. So there's no denying that. I also have Niren Kaul, COO of Suraksha Diagnostics. Let's get an idea of what the situation is. Mr. Kaul, can you tell us more about, there are reports now that very soon it's not just oxygen medicine, it's also human resource, health workers who are falling ill. And that could become a new area, and therefore the test results are coming late. That would have its own catastrophic, outcome if the tests results are not coming out in time. What are the issues being faced at diagnostic labs like yours?
The biggest issue that we have seen over last year, that the number of tests that we started doing last year and the tests that we started doing in the month of December, January, that actually dropped, and people were only getting tested for their flights and their travel requirements, and there were negligible cases of positivity at that point. Now, currently we are dealing with approximately 30% rate of positivity, and there are endless queues of people waiting anxiously to give their swab samples and everything. And the diagnostic labs all over the city and the state are trying their best to augment their capacity by adding more and more machines and manpower. It has been a kind of a silver lining that most of our manpower has already been vaccinated, but still you have many more people that you want. Every institution wants more and more healthcare workers, and those guys are still, after joining, get directly on ground and start performing and start doing their duty. They are tirelessly trying to cope up with this additional stress of meeting people's expectations and everything, trying to get to each and every phone call that comes, leading to take a sample and, kind of give the results faster. So this is what the diagnostic labs in the city are trying to, cope up to. And my recommendation to all the parties that, are there, they should work together to solve this problem rather than, throwing reasons at one another. They should try to together sit down and close this.
Yes, absolutely. That's precisely what I'm trying to say here, and thanks for pointing that out, Mr. Kaul. So, Touseef Khan, the damage is done. What are you going to do now to restrict the damage? It simply does not help to be constantly in this collision course with the center. You need center to help you out. The oxygen distribution is something that the center has the total prerogative over. Vaccination is something that the center is deciding on the majority of the issues around its policy. What, according to you, is the way forward for West Bengal? A lot of damage has already been done.
No, Mamata Banerjee has already declared that she has placed a request with the central government for providing about 1 crore vaccines in the coming weeks, and for not diverting the state-produced oxygen out of West Bengal, because the consumption level of oxygen is going to rise in the state. Secondly, she has also informed the press that industrial units have been asked to divert the oxygens for medical uses at present, and she has also, and we have seen, various non-government organizations and various institutions. They've also come forward to convert, places like community hall to be converted into, places where corona patients can come and take oxygens. So maybe private hospitals also can, come in and convert some of the hotels for, patients' use. And let me point out this very important fact. It is very unfortunate that the top 3 5-star hotels in Kolkata,
Yes,
half of it is occupied by BJP leaders who have come from outside, and they call it a control room only for election purposes. Since the election in West Bengal is stretched over a month, they have been lodged here for past 3 months, and God knows for how long they will continue to be here. Will BJP convert these hotel rooms for vacate these hotel rooms so that they can be converted for and reserved, for corona patient purposes? I really doubt that. This is a time for inspection.
okay.
All political
Let
leaders
me ask
should
Anila
rise
Singh
above
whether
the
they will do that, and I also want to know, right? Yeah, and you should. Yeah, that's precisely what I was saying, that this blame game has continued for way too long. It's probably time now for a collaborative effort, Touseef Khan, rather than, always trying to find where the BJP is lagging behind. Perhaps Anila Singh ji should answer that question on whether somewhere winning Bengal became more important than winning over COVID, Anila ji.
After listening to 2 health experts on your panel, thank God Mr. Khan's voice is tamed now. So, Mr. Khan, you must understand that corona is not of Bharatiya Janata Party or of any other political
But
party,
it is
and
due
we
to
have
your
to seal it
negligence,
in.
ma'am.
Why you get so rattled whenever I speak? I know that TMC knows that after 2nd of May, he won't be there.
Just avoid the
in Bengal.
personal comments.
So
Just stick to the
I
points
am
that you're
making
making,
the point
Anila
every
ji.
time he interjects in between. And he is talking about 2 5-star hotels for the for the
Three.
COVID patients. So 3. Let me tell you, after 2nd of May, when Bharatiya Janata Party is going to form government in West Bengal, proper hospitals will be made for the COVID patients, and within no time.
So you will not
we
vacate
have
hotels.
protective
Okay.
expertise. So you do not worry that you might be living in a 5-star culture. Bharatiya Janata Party is not like that. So stop blaming and accusing. Secondly, definitely all these states, they are working in good coordination with the center. As Dr. Basu said, that this is the time we have to deal with the coronavirus, not the political tantrums. And the voting is going to tell that the people of West Bengal are interested in which political party to rule in their state. But I know one thing, that Prime Minister of our country,
You're
he
still
is working
focused on
very,
election.
very dedicatedly, and within no time, the attack which this the new mutated coronavirus has done on our citizens, the help is coming across the borders as well as within the country. the agencies are assuring, whether we talk about the medicine or the oxygen or other corona facilities, that should be provided to the citizens pan states. So
are you also
accusing
assuring that there will be no discrepancy, whether it's a BJP rule state or a non-BJP rule state, there will be equitable distribution without any discrimination, Anilaji?
Absolutely, because after 2nd of May, we have to take care of West Bengal, so we are more vigilant. You can say so. We want the people of West Bengal to be taken care of in a very, very proper way.
Okay,
Because
last word to both to both the politicians. Touseef Khan, now the EC has said that it's going to ban all kind of victory procession. At least now, can we hope that political parties will respect this and not try to violate this rule which the Election Commission has spelled out? Since you've been saying time and again, the EC should crack the whip. They have now for the 2nd of May. Are you going to follow it in letter and spirit?
Absolutely welcome decision of Election Commission. No victory procession for any party, for any political leader. But they are very late. I really am very sad that Election Commission will, succumbed to the demand of BJP and not clubbed the remaining election. This is very, very unfortunate.
So I just wanted to...
Anilaji, your response to that. Will you make sure that there is no victory procession whatsoever? No
Absolutely.
gloating about who has won how many seats and how you made it or didn't make it or whatever.
We have always honored any decision being taken by the honorable courts or the Election Commission. And let me tell you, Prime Minister Narendra Modi ji has always said that we should have all the elections at one time. So throughout the year by year, people or the agencies are not involved into elections only. They should work for the country. But the thing is, whenever Prime Minister says such thing, they say, no, there is something of his
No, but
own
it was
agenda
time to walk the talk, Anilaji. We'll have to leave it at that, unfortunately. This time it was important to club the phases so that, gatherings could be averted. That did not happen. Yes, I do agree that the Prime Minister had always espoused that for the entire nation, there should be elections at the same time for state and centre. Thanks very much for joining us, Mr. Touseef Khan, Anila Singh ji, and also Mr. Kaul and Dr. Basu for giving us your time this afternoon. Well, that's it for now. News and updates continue on the other side. Do stay with us. Also visit us on mirnanews.com and follow us on our social media handles for more updates.